Disaster Management Systems presents Firefighter Rehab. The DMS Firefighter Rehab Vest, Flag, and Accountability Kit supports NFPA 1584 recommended practice on the rehabilitation of members operating at all incidents and training exercises. Understanding the tag. The Firefighter Rehab tag includes the following: firefighter information with entries for name, login and out time, unit assignment, agency, PPE level, employee number, comments, age, and gender. National Weather Service conditions with entries for temperature, wind chill, wet, and index. Heat symptoms with entries for nausea, weakness, headache, sunburned, absence of sweating, shortness of breath, cramping, seizure, rapid heart rate, flushed skin, exhaustion, mental confusion, and dehydration. Cold symptoms including headache, slow pupil response, waxy pale skin, low blood pressure, numbness, blisters, mental confusion, muscle rigidity, and dehydration. An initial vital sign entry. Check boxes if medical care is required. If medical care is administered, an admitted by box is available for accountability purposes. The rehab check-in receipt and the rehab release receipt. Both are to be used for the personnel accountability log. On the back of the tag, rehab procedures and processes. Responsible personnel. Establishing standard operating guidelines is the responsibility of each department's company officer or supervisor on scene. Assessment of his or her crew to determine members in need of rehab must occur every 45 minutes. Individual firefighters and their supervisors shall undergo rehab following use of a second 30-minute SCBA cylinder, after a single 45 or 60-minute cylinder, or after 40 minutes of intense work without SCBA. Supervisors are permitted to adjust these timeframes depending on work or environmental conditions. In addition, EMS staff must have the authority to detain members in rehab or transport members when there are obvious indicators preventing them from return to full duty. Rehab pre-release checklist. The incident commander must establish rehabilitation according to the circumstances of the incident. The rehabilitation process must include the following: relief from extreme climatic conditions, cooling or warming, rehydration, calorie and electrolyte replacement, medical monitoring, rest, and personnel accountability. There's also an entry field for oral solutions administered, including water, electrolyte, and food. Pre-release vital signs entry, and the release accountability entry. Accountability log setup. Prior to the incident, peel the backing from the small sleeve. Stick this small sleeve under each logged-in receipts column. After the incident, peel the backing from the large sleeve and stick the large sleeve under each logged-out receipts column. Using the accountability log. Upon check-in, personnel fills in firefighter information in the logging column of the accountability log. Once the firefighter information has been entered on the accountability log, insert the rehab check-in receipt into the logged-in receipts column. The personnel assigned to complete the rehab tag completes the release receipt upon release of the firefighter. Upon release, personnel assigned to completing the rehab tag must also sign the released by portion of the tag. Personnel assigned to the accountability log fills in the necessary information regarding the release. At the conclusion of the incident, the rehab manager places all release receipts in the accountability log for reconciliation.